This section is entitled Toxicology Cases. In this section, we'll be going over some scenarios that you could possibly see on step 1 that would involve drug toxicology. In the next section, we'll go over some toxicology vignettes. For the first case, we have a 37-year-old obese male who's presenting with recent worsening of his anginal symptoms. The history of present illness: he suffers from coronary artery disease and regularly takes anti-anginal medications. 1 month ago, he began to take an herbal supplement for weight loss to increase his energy level. He drinks approximately 3 cups of coffee per day. On physical exam, his vital signs include a blood pressure of 150 over 100 and a pulse of 100 beats per minute. His physical exam is unremarkable. Some questions. What drug would the patient most likely be taking in order to lose weight? Also, what effects does that medication have on the autonomic nervous system, and what treatment do you recommend? So many patients take ephedrine to lose weight. The effects of ephedrine are similar to amphetamines. Remember that these medications can increase heart rate and increase blood pressure. And remember that this medication was banned in 2004. Remember that if the patient were to stop taking ephedrine, that would lower the blood pressure of the patient, and that would improve cardiac function. It would decrease afterload and improve the anginal symptoms. And also, decreasing the heart rate improves the cardiac oxygen requirement and would improve the angina as well. It's important for patients that have established coronary disease, who have worsening chest pain, to have that coronary disease evaluated, either with a stress test or with an angiogram. Case number 2, 48-year-old male factory worker brought to the emergency room after a chemical spill and is having difficulty breathing and has irritation of his eyes and his throat. On physical exam, he's conscious, alert, and oriented. He has a strong chemical smell. He has hyperemia, which means erythema of the conjunctiva and upper respiratory passages. And he has an edematous tongue with mucosal sloughing. Some questions. What is the most likely toxic exposure in this patient? What are the risks to the patient? And what treatment is recommended? So ammonia poisoning and ammonia toxicity is pretty common in people that work in industry. Ammonia is used in the production of fertilizer, household chemicals, and commercial cleaning agents. It has corrosive effects on the eyes and the respiratory tract. There's no specific antidote from ammonia. The most important thing is for the area that's been exposed to ammonia to be washed thoroughly. And then for these patients, the first thing is actually to remember your ABCs. If the airway is compromised, that patient may need to be intubated. Pain control is also very important for these patients. Toxicology case number 3. A 10-year-old boy living near a pigment manufacturing industry presents with burning sensation in a glove and stocking distribution, together with severe bilateral arm and leg weakness. On physical exam, the patient has hyperpigmentation and thickening of the skin over the palms and soles. The patient also has raindrop depigmentation. What that entails is little drops, little areas on the leg that are without pigment. Patient also has Aldrich-Mees lines over the fingernails. What that is if this is the fingernail and this is the finger, these are lines across the fingernail horizontally that are usually dark in color. This patient also has decreased sensation, decreased motor strength, and wasting in the arms and legs. This is a representative drawing of what this patient's feet look like. You can see the skin thickening over the plantar surface. What toxic exposure would you suspect, and what is the recommended treatment for this patient? On labs, you see that the patient has elevated arsenic levels in the blood, urine, and hair. So this is arsenic poisoning. Arsenic is still used in pesticides, herbicides, and rat poisons, and also in the metallurgic industry. Acute intoxication of arsenic can cause diarrhea, liver and renal necrosis and shock. The treatment for arsenic poisoning is dimercaprol or succimer to chelate the arsenic out of the system. Toxicology case number 4. A 5-year-old male was brought to the medical clinic because of episode of sudden vigorous vomiting. According to his mother, he's been behaving strangely. He also was complaining of weakness in his hands and feet. On physical exam, he is pale and lethargic. He has discoloration of his gums, and he has wasting in the muscles of his hands. The questions here: what toxic exposure would you suspect? What environmental factors should you ask about? What are some labs you'd want to order? What are the main organ systems affected? And what is the recommended treatment? So on labs, you do a complete blood count, and on the smear you see a microcytic anemia with basophilic stippling and elevated lead levels. This patient has lead poisoning. The sources we've talked about already can include lead paint, retained bullet, clay utensils, gasoline, and also alcohol that's distilled in automobile radiators. The way that lead causes cellular damage is by binding to disulfide groups. This can affect many different proteins, but it can specifically inhibit 2 enzymes in the heme synthesis pathway, porphobilinogen synthase and ferrochelatase. Both of these are responsible for the production of heme and the incorporation of iron into heme, which can damage red blood cells. The treatment, obviously, is removal of the exposure and then chelation therapy like we've talked about already. Toxic case number 5. 5-year-old female brought to the emergency room by her parents for severe nausea, hematemesis, and abdominal pain. On history of present illness, the patient had been playing candy maker in the parents' room, and an open medication bottle was found on the floor. On physical exam, she's lethargic and disoriented, tachypnic, she has a fever, she has a flushed face, and has abdominal pain. What is the most likely toxicity here in this patient? What is the recommended treatment? And what do you expect the arterial blood gas results to show? So this patient has aspirin toxicity. Remember, aspirin will cause a complex acid-base disorder with both a metabolic acidosis from the chemical and a respiratory alkalosis from a direct stimulatory effect on the breathing center and the brainstem. Remember that aspirin toxicity can cause symptoms at just 5 times the normal dose. It can cause GI irritation because of ulcer disease. It can cause hyperventilation because of the respiratory alkalosis. It can cause metabolic acidosis, and it can cause high fevers from hyperpyrexia. Also, in these patients, you can have tinnitus and vertigo and bleeding complications in these patients as well from inhibition of platelets. These patients generally are pretty acidotic and will require extensive fluid boluses in order to replace the fluid loss. That will also improve the metabolic acidosis. Activated charcoal will work to bring the drug out of the system. You can also alkalinize the urine in these patients to enhance the renal elimination, and acids can be used for the stomach upset. Toxicology case number 6. Here we have a 37-year-old male brought to the emergency room by an ambulance after collapsing at work at a metal plating factory. The patient reported a headache prior to collapsing. On physical exam, he's unresponsive to external stimuli, has a bitter almond smell to his body. His heart rate is 165 beats per minute. His blood pressure is 90/50, which is low. And he's breathing only agonally, meaning short and shallow breaths. Questions here: what toxic exposure would you suspect? What is the mechanism of toxicity, and what is the recommended treatment? The bitter almond smell sort of gave it away. This is cyanide. Cyanide is a very powerful poison. Again, blocks cellular respiration. It's used in metal plating industries, shoe polish, photographic industries, and you need to give the antidotes very quickly. Remember ABCs, supplemental oxygen. The nitrite medication, amyl nitrite, sodium nitrite, can produce methemoglobin, which will scavenge cyanide, and sodium thiosulfate will accelerate conversion of cyanide into thiocyanate, which can be excreted by the body. This is the end of the toxicology case study section. In the next section, we'll be going over antibiotics.